Hey everyone, in today's video, I'm going to talk about how business models affect nursing. If you want to gain more information about nursing or to improve your nursing knowledge in general, please consider subscribing down below. I upload a video every single week and you don't want to miss them. Alright, so let's get right into this week's topic. I want to talk about business models. Now, I personally live in Canada, and I know US has a bit of a different system, of course. You know, it's pay for service, and in Canada it's a free healthcare system. But I do notice from colleagues that have come from the States, they also mention that, you know, a business model is very important for directing care. And I really want to explore that in today's video. Hey everyone, check out these new nursing t-shirts that I personally have created. I hope you like these designs, and if you're interested in purchasing them, click the link in the description box down below. Thanks for watching. So as some of you may know, hospitals work on budgets. Each floor has a certain budget they have to meet. They have goals and they have certain constraints when it comes to spending, and that makes sense. Otherwise, you know, a hospital is not a free-for-all. They're at the end of the day, it's a business and they have certain budgets and expenses that they have to meet. Now, what I want to talk about is specifically how the budget affects nursing care. So a patient that gets admitted can be billed through our healthcare system. In the States, for example, if you get admitted to a hospital, you know, each hour that you're there, you're getting charged for it. So it actually becomes very, very expensive for some of the public to reach healthcare, which is a whole different discussion that I don't really want to get into in this video. I want to speak to how budgeting affects patient care. Because every time you admit and discharge, you know, you get money, the hospital's really stressed, and it's kind of like a burden on the managers to get patients flowing in and out. Now, it makes sense from an overall picture, but when you're providing care, sometimes it may not be appropriate for certain patients to go home. However, they have no better option. We can't, like, for example, I'll give you an example. There's a patient who was in a lot of pain, and so we gave them pain medication, and the managers and the nursing coordinators that deal with the admission and discharges thought that they should just be sent home on a trial of these new prescription pain medications, and if they don't thrive, they'll have to come back. But you know, ideally you want to have that patient stay in the hospital, trial the medication. If the medication works, then it's safe for that patient to go home. However, in this case, because they want to promote more admissions, they're going to push that patient out, get a new patient in, and then we have to deal with that patient. Then all of a sudden that patient that we sent home earlier, you know, the pain medication doesn't work, they can't cope, and God forbid they fall and they have to be readmitted. So a lot of times you see situations like this where, you know, your goal is to provide a safe discharge home. However, there are certain situations and cases that this is quite challenging to meet. For example, if that patient with pain didn't go home, then that new admit that was sitting in emergency, right, wouldn't get the treatment they need because the emergency doesn't have the staff to deal with a huge influx of patients. So all of a sudden you have this systemic issue where you either have to send patients home, right, on a trial of an intervention. For example, in this case, it's the new medication the patient's on, or you don't send the patient home, then the person in emerge doesn't get the care they need, and then you put them at risk. So overall, I think what the hospitals are doing makes sense, but it just doesn't sit right with me, knowing that we are sending somebody home that we know may not be entirely safe. And I've seen this a lot, and a lot of nurses have seen this, and when you work on a medical or any floor for that matter, you send somebody home and it's a little bit too early, you feel like you didn't do the best for that patient. But at the same time, you know that in the emergency department, they're seeing so many patients, there's so many people waiting to get treated that it's unsafe for them to stay there. So what do? Do you let that patient go home on a trial of new medication, or do you let that patient in emergency sit and suffer? I would love to hear your opinion on this. Leave a comment down below what you think is right. But I don't think there is a right answer. It's difficult for someone to, you know, make a decision on that. And that's personally why I never wanted to go into management, especially in a hospital setting, making decisions on whether, you know, a floor has a certain amount of budget, and you know, if they need more equipment, they can't get it because it doesn't meet their budget. And then ultimately the patient can't get the care they need because they don't have enough equipment. I hope you guys enjoyed this video. If you did, please consider giving it a thumbs up. Please be sure to follow me on my Instagram. It's way up there. And also make sure you check out the description box down below where I have links to my free ebooks, my fitness guide, my nutrition guide, and I also have a 45-day NCLEX plan where I teach everyone how I passed the NCLEX and how you can pass it too. So you definitely want to check out the links in the description box, and be sure to check out my other videos. I have playlists on my channel, and thank you very much for watching. We'll catch you in the next one.